One patient, one record.
One patient, one record.
SehR is a health record that is the patient's, but it's being shared amongst a variety of different practitioners. And it's our new ability to be able to see all the data regardless of where the patient is being seen.
8 to 4, yes, it's 8 to 4:30.
This allows us to share patient information across doctors' offices, the hospitals. Anyone who cares for the patient will have access to the patient's health information.
One patient, one record.
One patient, one record.
I think the most common misconception about SehR is that a lot of the things about building order sets or building clinical content in this project is done by folks within information services, when in fact it's really a collaborative effort from folks in information services as well as those folks who are actually on the front line of actually providing care. And that could go from the pharmacists involved in patient care, physicians and nurse practitioners and physician assistants involved in care, as well as nurses on the front lines taking care of patients.
One patient, one record.
One patient, one record.
The shared health record is absolutely invaluable. The ability to actually have the chart available when you need it, the ability to bring contemporary information from the inpatient setting to the outpatient setting and from the outpatient setting to the inpatient setting, that's unbelievable.
As a health system, we have made a commitment to being the best that we can be, and we are very good. When we're compared nationally, we are amongst the best. If we're going to continue to be the best in this country at providing quality health care in a cost-effective, affordable way, we need to keep improving. And part of this, the implementation of the SehR project, is to improve the platform on which we provide care, improve the platform on which we administer those systems, etc. And so part of this project is about us maintaining our status or our standards or our discipline around being the best we can for the people that we serve in this state.
One patient, one record.
One patient, one record.
In order to make this all work, it takes a huge amount of time, it takes a huge amount of effort, it takes a lot of trust, and it takes a lot of fits and starts.
Having gone through this experience previously, I will validate the fact that it will be painful. Having survived it 10 years ago and come out the other side of it, I will tell you there's no way I would ever practice medicine without access to a product like Epic or a shared health record.
How do we get that conversion work, all of that pre-work up front, all that data, registration, scheduling, and electronic medical record information, how do we get that in the system?
This project is going to be difficult. We are trying to implement a very sophisticated system, the Cadillac in the industry, across a number of organizations in a very broad geographic area. We're going to have setbacks as we try to implement this project. We have already had setbacks as we implement this project. So things are going to happen, and we're going to go through periods where people are going to be down over the project, but there will be periods where people will be high over the results of the project. And so what's important there is that throughout that whole process, the highs and the lows, that everybody have a very positive attitude in our organization, because if we don't, we're not going to get there as a team.
The focus of all of this is on what's best for the patient, not what's best for the healthcare providers, not what's best for the IT department, not what's best for the bottom line of Maine Health. It's really about what's best for the patient.